Question 1. Before approaching a person who has collapsed, what is the first thing a BLS rescuer should do? A. Check for a pulse. B. Ensure the scene is safe. C. Begin chest compressions. D. Shout for help. Answer: B. Ensure the scene is safe. This question tests the crucial concept of scene safety, which is the very first step in any emergency. The keyword "first thing" emphasizes its priority. Always make sure the environment is safe for both yourself and the person in need of help before doing anything else, like checking for a pulse or starting CPR, to prevent further injury or becoming a victim yourself. For instance, if someone collapses in the middle of a busy road, the first step is to move them or divert traffic, not immediately start CPR. A good way to remember this is, you can't help someone if you become injured yourself, so safety first, always. Question 2. When using an automated external defibrillator, AED, on an adult, what is the correct placement for the pads? A. One pad on the left arm and one on the right leg. B. One pad on the upper left chest and one on the lower right side of the chest. C. Both pads on the upper chest, one above each nipple. D. Both pads on the back, one on each shoulder blade. Answer: B. One pad on the upper left chest and one on the lower right side of the chest. This question focuses on the proper placement of AED pads for an adult, which is essential for effective defibrillation. The keyword "correct placement" highlights the importance of precise positioning. The pads need to be placed so that the electrical current can pass through the heart. One pad typically goes on the upper right side of the chest, above the nipple, and the other pad on the lower left side of the chest, below the nipple and to the side. This specific placement ensures the electrical shock crosses the heart, effectively delivering therapy. Remember, proper pad placement is key to delivering a successful AED shock. Question 3. What is the recommended compression depth for effective chest compressions on an adult during CPR? A. At least 1 inch 2.5 centimeters. B. At least 2 inches 5 centimeters. C. No more than 3 inches 7.5 centimeters. D. Exactly 1.5 inches 3.8 centimeters. Answer: B. At least 2 inches 5 centimeters. This question addresses the critical BLS component of proper compression depth for adults, which directly impacts the effectiveness of CPR. The keyword "recommended compression depth" points to a specific guideline. Compressions must be at least 2 inches deep but no more than 2.4 inches 6 centimeters to adequately circulate blood to the vital organs, especially the brain and heart. Insufficient depth doesn't provide enough blood flow, while excessive depth can cause injury. For example, when performing CPR on an adult, you should press down hard enough to visibly depress the chest by at least 2 inches. Always push hard and fast when doing compressions on an adult. Question 4. A conscious adult is choking and cannot speak, cough, or breathe. What is the initial action a rescuer should take? A. Perform chest compressions. B. Administer abdominal thrusts, Heimlich maneuver. C. Give 5 back blows. D. Encourage the person to cough more forcefully. Answer: B. Administer abdominal thrusts, Heimlich maneuver. This question tests the appropriate response to a conscious adult who is experiencing a severe foreign body airway obstruction. The keywords "cannot speak," "cough," or "breathe" indicate a complete blockage requiring immediate intervention. For a conscious adult with a severe choking incident, the primary intervention is to deliver quick, forceful abdominal thrusts to dislodge the object. Encouraging them to cough or giving back blows is not the initial action for a conscious adult in this situation. Imagine someone holding their throat and unable to make a sound. That's your cue to start abdominal thrusts. Your goal is to get that object out quickly and efficiently. Question 5. When checking for a pulse on an adult, which artery should a BLS rescuer typically check? A. Radial artery. B. Brachial artery. C. Carotid artery. D. Femoral artery. Answer: C. Carotid artery. This question focuses on the correct site for pulse checks in adult BLS, which is crucial for quickly assessing circulation. The term typically check refers to the most reliable and accessible pulse for a lay rescuer. The carotid artery, located on the side of the neck, is the recommended site for adults and children because it is a large artery close to the heart and is often palpable even when blood pressure is low. The brachial artery is used for infants, and the radial artery, wrist, can be difficult to find in an emergency. Always remember to feel for the carotid pulse gently on one side of the neck. Question 6. What is the recommended rate for chest compressions for all age groups, adults, children, and infants, during CPR? A. 60 to 80 compressions per minute. B. 80 to 100 compressions per minute. C. 100 to 120 compressions per minute. D. 120 to 140 compressions per minute. Answer: C. 100 to 120 compressions per minute. This question addresses the universal compression rate guideline across all age groups in CPR. The keyword recommended rate emphasizes the specific speed required for effective compressions. Regardless of whether you are performing CPR on an adult, child, or infant, the chest compression rate should be between 100 and 120 compressions per minute. This consistent rate ensures adequate blood circulation to the brain and other vital organs. A good way to remember this is to compress to the beat of a song like "Stayin' Alive" by the Bee Gees. Question 7. After each chest compression, what is an essential action for ensuring high-quality CPR? A. Immediately give 2 rescue breaths. B. Allow the chest to fully recoil. C. Check for a pulse again. D. Switch rescuers immediately. Answer: B. Allow the chest to fully recoil. This question highlights a critical component of high-quality CPR, chest recoil. The keyword essential action indicates its importance for effective circulation. Allowing the chest to fully recoil means letting the chest wall return to its normal position after each compression, which allows the heart to refill with blood before the next compression. Without full recoil, blood flow is significantly reduced, making compressions less effective. Think of it like a pump. It needs to fully expand to draw in water before it can push it out again. Always remember to push hard and allow for full chest recoil. Question 8. What is the correct compression to ventilation ratio for a single BLS rescuer performing CPR on an adult? A. 15 compressions to 2 breaths. B. 20 compressions to 2 breaths. C. 30 compressions to 2 breaths. D. 5 compressions to 1 breath. Answer: C. 30 compressions to 2 breaths. This question tests the specific ratio for CPR when a single rescuer is present for an adult. The keyword single BLS rescuer is the clue that indicates this particular ratio. For an adult, whether you are alone or there are 2 rescuers, the ratio is always 30 compressions followed by 2 breaths. This ratio balances the need for continuous chest compressions with adequate oxygen delivery. For example, after delivering 30 strong compressions, you should then quickly deliver 2 rescue breaths. Always remember 30 and 2 for adult CPR. Question 9. In the chain of survival, which link represents early recognition and activation of the emergency response system? A. Early CPR. B. Rapid defibrillation. C. Integrated post-cardiac arrest care. D. Immediate recognition of cardiac arrest and activation of the emergency response system. Answer: D. Immediate recognition of cardiac arrest and activation of the emergency response system. This question assesses knowledge of the initial and crucial link in the adult chain of survival, a sequence of actions that improve survival from cardiac arrest. The phrase early recognition and activation directly points to the first step. The chain of survival begins with recognizing that someone has collapsed and activating emergency medical services, EMS, by calling 911 or your local emergency number. This prompt action is vital because it sets all subsequent life-saving interventions in motion. Think of it as the starting gun for the race to save a life. Getting EMS on the way immediately is paramount. Question 10. When should a BLS rescuer activate the emergency response system, e.g., call 911, for an unresponsive adult who is not breathing normally and has no pulse? A. After performing 5 cycles of CPR. B. Immediately after determining unresponsiveness and absence of normal breathing/pulse. C. Only after an AED is available. D. After delivering 2 rescue breaths. Answer: B. Immediately after determining unresponsiveness and absence of normal breathing/pulse. This question focuses on the critical timing of activating emergency medical services, EMS, during a cardiac arrest scenario for an adult. The keyword "when" should emphasizes the urgency. For an adult who is unresponsive, not breathing normally, and has no pulse, the rescuer should immediately activate the emergency response system and then begin CPR. Delaying activation can significantly reduce the chances of survival, as professional help and advanced interventions are needed quickly. Think of it as the call first, then do CPR principle for adults. Question 11. Which technique should a single BLS rescuer use for chest compressions on an infant? A. 2-thumb encircling hand technique. B. 1-hand technique. C. 2-finger technique. D. Heel of 1-hand technique. Answer: C. 2-finger technique. This question specifically asks about the single rescuer compression technique for infants, highlighting the difference in pediatric CPR. The keyword "single BLS rescuer" is crucial here. For a single rescuer, the recommended technique for infant chest compressions is the 2-finger technique, using 2 fingers placed on the sternum just below the nipple line. The 2-thumb encircling hand technique is preferred for 2 rescuers, as it can deliver more effective compressions. Always remember that for a lone rescuer with an infant, 2 fingers are all you need to start compressions. Question 12. If an adult suddenly collapses and is unresponsive, not breathing normally, and has no pulse, what is the most important initial action to improve their chances of survival? A. Providing rescue breaths. B. Performing high-quality chest compressions. C. Administering aspirin. D. Elevating their legs. Answer: B. Performing high-quality chest compressions. This question emphasizes the most critical intervention in adult cardiac arrest. The keyword "most important initial action" points to the primary focus of BLS. High-quality chest compressions are the most important initial action for an adult in cardiac arrest because they circulate oxygenated blood to the brain and heart, which buys time until defibrillation or advanced care can be provided. Without effective compressions, blood flow to vital organs ceases, leading to irreversible damage. Think of compressions as manually pumping the heart to keep the person alive. Question 13. When performing CPR on a child, what is the recommended compression depth? A. At least 1 inch 2.5 centimeters. B. At least 1.5 inches 3.8 centimeters. C. At least 2 inches 5 centimeters. D. Approximately 1/3 the depth of the chest, about 2 inches 5 centimeters. Answer: D. Approximately 1/3 the depth of the chest, about 2 inches 5 centimeters. This question addresses the specific compression depth for children, distinguishing it from adult and infant guidelines. The keyword "child" is the critical clue. For a child, The recommended compression depth is approximately 1/3 the depth of the chest, which is typically about 2 inches 5 centimeters. This depth is less than that for an adult but more than for an infant, ensuring adequate blood flow without causing injury. Always remember to adjust your compression depth based on the size and age of the person. Question 14. A BLS team member is responsible for managing the airway and delivering ventilations. Which role is this person fulfilling within the team? A. Compressor. B. AED/monitor. C. Airway. D. Team leader. Answer: C. Airway. This question tests knowledge of defined roles within a BLS team, which helps streamline resuscitation efforts. The phrase managing the airway and delivering ventilations directly describes the responsibilities of the airway role. In a BLS team, each member has a specific task to ensure efficiency and effective care, such as the compressor delivering chest compressions or the AED/monitor operating the defibrillator. Understanding these roles helps the team work together smoothly, just like different players on a sports team. Question 15. What is the initial action if you suspect an opioid-associated life-threatening emergency and the person is unresponsive and not breathing? A. Immediately give naloxone. B. Start CPR and activate EMS. C. Provide rescue breaths only. D. Place the person in the recovery position. Answer: B. Start CPR and activate EMS. This question covers the critical initial response to a suspected opioid-associated emergency when the person is unresponsive and not breathing. The phrase unresponsive and not breathing indicates a cardiac or respiratory arrest, regardless of the cause. Even if an opioid overdose is suspected, the immediate priority is to activate emergency medical services, EMS, and begin CPR, specifically focusing on ventilations, as respiratory arrest is common. Naloxone can be given, but it does not replace the need for CPR and calling for help. Always remember that CPR and calling for help are the foundation for any unresponsive person not breathing. Question 16. An adult is eating in a restaurant and suddenly clutches their throat, unable to make any sound. They then become unresponsive. What is the next step for a BLS rescuer? A. Administer abdominal thrusts until they respond. B. Call 911 and begin CPR, starting with chest compressions. C. Check their mouth for the obstructing object. D. Place them in the recovery position. Answer: B. Call 911 and begin CPR, starting with chest compressions. This question presents a scenario of a conscious choking adult who becomes unresponsive, which requires a shift in BLS approach. The critical clue is becomes unresponsive, indicating a change from a choking emergency to a cardiac arrest situation. When a choking person becomes unresponsive, you must activate EMS immediately and then begin CPR, starting with chest compressions. Each time you open the airway for breaths, look for the object and remove it if seen. Remember, once unresponsive, the approach shifts to standard CPR, with the added step of checking the mouth. Question 17. When is it appropriate to place an unresponsive, breathing person in the recovery position? A. If they are in cardiac arrest. B. If they are suspected of having a spinal injury. C. If they are breathing normally and have no signs of trauma. D. While waiting for the AED to analyze their rhythm. Answer: C. If they are breathing normally and have no signs of trauma. This question focuses on the appropriate use of the recovery position, a safety measure for specific situations. The key conditions are unresponsive, breathing normally, and no signs of trauma, which indicate they are not in cardiac arrest but still need airway protection. The recovery position helps keep the airway open and prevents aspiration, breathing in vomit, for someone who is unresponsive but still breathing on their own. It should not be used if there's a suspected spinal injury or if the person isn't breathing. Always remember that the recovery position is for someone who is unresponsive but breathing. Question 18. What is the maximum time a BLS rescuer should take to check for a pulse? A. 1 second. B. 5 seconds. C. No more than 10 seconds. D. 30 seconds. Answer: C. No more than 10 seconds. This question addresses the critical time limit for pulse checks in BLS, emphasizing the need for quick assessment. The phrase maximum time indicates a strict guideline to prevent delays in starting life-saving interventions. A pulse check should be performed for no less than 5 seconds and no more than 10 seconds. Taking longer than 10 seconds delays the initiation of chest compressions, which are vital for survival. For example, if you can't find a pulse within 10 seconds, assume there isn't one and begin CPR. Remember, time is critical during a cardiac arrest, so assess quickly. Question 19. A BLS rescuer arrives at the scene of a collapsed person. Before touching the person, the rescuer should ensure proper use of personal protective equipment, PPE. This is an example of applying what principle? A. Chain of survival. B. Good Samaritan law. C. Universal precautions. D. Patient confidentiality. Answer: C. Universal precautions. This question tests the understanding of fundamental safety principles in emergency care, specifically the use of protective barriers. The phrase proper use of personal protective equipment, PPE, before touching the person is a clear indicator of universal precautions. Universal precautions are a set of guidelines designed to prevent the spread of infection by assuming that all blood and body fluids may be potentially infectious. This means wearing gloves and other PPE, like a mask or eye protection, when there's a risk of exposure. Always protect yourself first with universal precautions to stay safe. Question 20. For a child who needs CPR, if you are a single rescuer, what is the preferred hand placement for chest compressions? A. 2 hands, interlaced fingers. B. Heel of one hand. C. 2 fingers. D. Both thumbs encircling the chest. Answer: B. Heel of one hand. This question differentiates the preferred compression technique for a single rescuer on a child. The keywords child and single rescuer are essential clues. For a single rescuer performing CPR on a child, the heel of one hand is generally preferred to achieve the correct depth and rate while minimizing the risk of injury. 2 hands might be too much pressure for a smaller child, and 2 fingers are for infants. Always adjust your technique based on the size of the child to ensure effective yet safe compressions. Question 21. An infant is conscious and choking but cannot make any sounds. What is the correct sequence of actions for a BLS rescuer? A. Alternate 5 back blows and 5 chest thrusts. B. Perform abdominal thrusts, Heimlich maneuver. C. Deliver 5 back blows followed by a pulse check. D. Begin CPR immediately. Answer: A. Alternate 5 back blows and 5 chest thrusts. This question tests the specific choking protocol for a conscious infant, which differs significantly from adult and child procedures. The keywords infant, conscious, and cannot make any sounds are crucial. For a conscious choking infant, the recommended sequence is to alternate between 5 back blows and 5 chest thrusts until the object is dislodged or the infant becomes unresponsive. Abdominal thrusts are not used for infants due to the risk of organ injury. Remember this specific combination of back blows and chest thrusts for choking infants. Question 22. After an AED delivers a shock, what is the immediate next step a BLS rescuer should take? A. Check for a pulse and breathing. B. Reanalyze the heart rhythm. C. Continue chest compressions immediately. D. Remove the AED pads. Answer: C. Continue chest compressions immediately. This question clarifies the critical action directly following an AED shock, emphasizing the importance of continuous circulation. The keyword "immediate next step" highlights the need for no delay. After an AED delivers a shock, you should immediately resume chest compressions without delay, even if the person appears to respond. Interruptions in chest compressions should be minimized as much as possible, as consistent compressions are vital for blood flow. Don't waste time checking for a pulse right after a shock. Get right back to compressions. Question 23. To ensure high-quality CPR, what is the maximum amount of time chest compressions should be interrupted? A. No more than 5 seconds. B. No more than 10 seconds. C. No more than 20 seconds. D. No more than 30 seconds. Answer: B. No more than 10 seconds. This question addresses a key aspect of high-quality CPR, minimizing interruptions. The phrase "maximum amount of time" emphasizes the strict guideline. Interruptions in chest compressions, such as for rescue breaths or AED analysis, should be limited to no more than 10 seconds. Longer interruptions significantly reduce the effectiveness of CPR by decreasing blood flow to vital organs. Think of it this way: every second compressions are paused, blood flow stops, so minimize those breaks as much as possible. Question 24. A BLS rescuer is providing CPR to an adult. After delivering 30 compressions, they should deliver how many breaths? A. 1 breath. B. 2 breaths. C. 3 breaths. D. 5 breaths. Answer: B. 2 breaths. This question confirms the standard compression-to-ventilation ratio for adult CPR. The numbers 30 compressions cue you to recall the corresponding number of breaths. For adults, the recommended ratio for CPR is always 30 compressions followed by 2 breaths, regardless of whether there is 1 or 2 rescuers. This balance ensures both adequate blood circulation and oxygen delivery. It's important to deliver both components for effective CPR. Keep the 30-to-2 ratio in mind for adult CPR. Question 25. Before starting CPR, after ensuring scene safety and checking for responsiveness, what should a BLS rescuer do if an adult is unresponsive and not breathing normally? A. Check for a pulse. B. Deliver 2 rescue breaths. C. Call 911/activate EMS. D. Look for medical alert jewelry. Answer: C. Call 911/activate EMS. This question tests the crucial immediate action after assessing an unresponsive, non-breathing adult. The keywords "unresponsive" and "not breathing" normally indicate a probable cardiac arrest requiring immediate professional help. For an adult, after confirming unresponsiveness and abnormal breathing, the first action is to activate the emergency response system, call 911, before starting CPR. This call-first approach for adults ensures that advanced medical help is on the way as soon as possible. Remember to always get help on the way quickly for an adult cardiac arrest.